Okay, let's unpack this. Have you ever, used a health app or maybe had one of those virtual doctor visits and just felt this could be better? Like the tech itself was a bit clunky.
Oh, definitely.
Yeah.
Or you hear about amazing advances, AI, digital tools,
Right.
but then parts of the healthcare system still feel, well, difficult to navigate, maybe even a bit unsafe sometimes.
Exactly. Well, today we're doing a deep dive into exactly that. We're looking at a really insightful recent review by Kushniruk and David Kaufman. It's called Human Factors and Organizational Issues in Health Informatics.
A crucial topic.
Absolutely. And our mission here is to pull out the key nuggets, the really important stuff about what makes health tech usable, useful, and critically safe. And this is based on very recent studies from 2022 and 2023.
Yeah, the landscape is changing incredibly fast.
That's one of the first things the review really hits on, just how fast health technology is evolving. It's way beyond just electronic health records now.
Oh, yeah.
We're talking AI helping with diagnosis, those mobile health apps on your phone, even virtual and augmented reality for things like training surgeons or educating patients.
It's a huge expansion. And what's really fascinating, the review points this out clearly, is the shift. We've moved from just showing off cool prototypes.
Right, the demo phase.
Exactly, to
Right.
actually deploying these things in the real world, in busy clinics, hospitals, people's homes.
And that changes everything, presumably.
It totally does. It forces a much bigger focus on the actual user experience. How do doctors, nurses, patients really interact with this stuff day to day?
Makes sense.
And there's another interesting thread that the review picks up, this growing idea of One Health.
One Health.
Yeah, it's about thinking bigger, considering the links between human health, animal health, and the environment when designing technology.
Huh. So like how pollution data might connect to asthma app usage?
Precisely. Or tracking diseases that jump between animals and humans. It's about designing for a more holistic view of health. It's a pretty significant conceptual leap for tech design.
That real-world deployment point you made, it connects to something else. It's always so easy, isn't it, to blame an individual when something goes wrong in healthcare. A mistake happens, and we look for the person responsible.
It's a sharp-end error.
Yeah. But this review, and it echoes that famous old "to err is human" report, really hammers home that it's usually not that simple. It's often systemic. The system sets people up for failure.
Absolutely. Which then begs the question, well, how do we even start to understand these incredibly complex systems? They're messy.
Right.
The review highlights some useful frameworks. One is called SEEPS, the Systems Engineering Initiative for Patient Safety.
Okay.
Yeah, it's a way to break down a work system. It looks at the person, the organization, the tech and tools they use, the actual tasks, and the environment they work in. All five interact.
So it forces you to look beyond just the screen.
Exactly. There's a great example in the review, a study on a system called CancelRx. It was designed to streamline how doctors discontinue medications.
Sounds useful.
On the surface, yes, it improves communication for the doctors. But the SEEPS analysis found it also massively increased the workload for pharmacists. And crucially, it introduced completely new ways for errors to happen in the pharmacy workflow.
Wow, so fixing one thing broke another almost.
Kind of. It shows you can't just optimize one piece in isolation. You have to understand the whole system, the whole workflow, anticipate those knock-on effects. That's a huge lesson for anyone designing or implementing health tech.
That CancelRx example really drives it home. It's like you fix a leaky pipe, but you accidentally increase the pressure everywhere else. So thinking systemically. What does this mean for making things safer? The review talks a lot about safety culture.
It does, and it's fundamental. Safety culture is basically making safety the top priority across the whole organization. It's embedded in how things are done, the values, the behaviors.
Not just a poster on the wall.
Definitely not. And there's solid evidence for this. Studies, even in places like military hospitals, show a strong safety culture. Particularly good teamwork within units doesn't just improve patient outcomes. It also significantly reduces staff burnout. They're linked.
That's huge. Less burnout means safer care too, usually.
Exactly. So fostering an environment where people feel safe speaking up, reporting errors or near misses without fear of blame.
Yeah.
That's essential. It has to be seen as a chance to learn and improve the system.
So focusing on learning, not blaming.
Right. It's also about understanding Not just why things go wrong, but why things go right most of the time, even when conditions are difficult. That's linked to an idea called safety too.
Safety too.
Yeah, it's about designing systems that don't just block errors, but actually support the way people adapt and adjust to make things work safely in complex situations. Supporting resilience, basically.
Okay, so we've covered a lot. This explosion in health tech, the need to look beyond individuals to the whole system using frameworks like SEEPs, and this absolute necessity of building a strong safety culture, focusing on learning and resilience, like with safety too. It's clear it's not just about having flashy tech.
Not at all. It's about how it fits, how it works with people within the messy reality of healthcare.
So we've learned a lot. Clearly, research is uncovering these crucial factors.
Yeah, the knowledge base is growing, which this review really shows.
But there's a but, isn't there?
There is, and it's a big one the review touches on. Knowledge translation.
Getting the research into practice.
Precisely. How do we make sure all these vital findings, these lessons learned from studies about SEEPs, about cancel arcs, about safety too, how do we ensure they actually get baked into the design, the buying decisions, the day-to-day use of the commercial health tech that, you and I and everyone else interacts with?
That gap between research and reality.
It's a huge challenge. So maybe the provocative thought to leave everyone with is, as you use or see health technology, think about that gap. How can we better bridge the research findings on human factors and safety with the actual tools being built and rolled out? That's something really important to ponder.